Did you know that heart disease affects 1 out of every 3 women in the United States? Yes, it's the leading cause of death in our country, surprisingly surpassing all others. However, heart health doesn't often make it to the top priority list for many women. In this video, we'll see how taking care of your heart should be a must-do and not just a nice-to-have on your to-do list, making the right dietary choices. Grasping the concept of fat and its significance in your daily meals is crucial for healthy eating. Fat is an integral ingredient of a nutritious diet. However, it should only constitute a minor part of a well-balanced diet mainly packed with proteins, fruits, and veggies. It's advisable to focus on consuming foods rich in unsaturated fats like nuts, fish, and avocados and steer clear from foods high in saturated fats, primarily found in animal-derived products like red meat and dairy goods. Trans fats, a type of saturated fat, are commonly found in items with extended shelf life, such as processed edibles and hydrogenated oils. They are notoriously infamous for boosting cholesterol levels. Therefore, as part of maintaining a healthy diet, it's smart to opt for foods low in saturated and trans fats. Ladies, it's paramount to eat right not just once in a while but throughout the entire year to guard against heart disease or boost your heart's health if you're already diagnosed with this condition. Make fruits and veggies, particularly vibrant ones, a staple of your daily meals. A few servings each day won't hurt. Find ways to sneak fiber into your meals every day. Lean more towards fish rather than red meat when it comes to your protein source. It's crucial to steer clear of foods loaded with saturated fats, sugar, sodium, and overly processed foods. In addition to that, make sure to hydrate sufficiently with water and try to cut down on caffeine-heavy drinks. When it comes to snack time, go for those that give a healthy boost instead of just filling your stomach. Eating 2 apples a day has been proven to decrease bad cholesterol levels. Grab a handful of nutritious nuts like pistachios, almonds, or walnuts. And don't forget those heart-friendly colorful snacks. Blueberries, strawberries, and grapes are excellent choices. It's absolutely critical for women to maintain a wholesome diet throughout the year, not just for general health but more specifically to fend off heart disease or keep it under control if it's already an issue. Always remember, your menu should have more than a pinch of color, meaning including fruits and veggies a few times over the course of your day. Let fiber-rich foods be an integral part of your daily meals, and lean more towards fish instead of red meat. There are certain foods that you should actively steer clear of. These include the ones packed with saturated fats, loaded with sugar, doused in high sodium content, or excessively processed. Make water your go-to thirst quencher while keeping your caffeinated drinks to a minimum. When it comes to snacks, they must be good for your health as well. An apple or 2 daily can help reduce your bad cholesterol levels. A palmful of pistachios, almonds, or walnuts are also great options. For a pop of color and a heart-healthy option, consider snacks like sweet strawberries, tangy blueberries, or juicy grapes. Shrink your midriff to under 35 inches. Your health could be on the line if you carry too much weight around your midsection. Stomach fat seriously threatens your cardiovascular health far more than fat in other parts of your body. Specifically, having a belly can significantly heighten your risk of heart disease. If you're a woman and your waist measures more than 35 inches, this puts you in a higher risk category for heart disease and also metabolic syndrome, a collection of risk factors tied to excessive abdominal weight. Metabolic syndrome affects about 20% to 25% of Americans. Additional risk factors include having fasting blood triglyceride levels above 150 milligrams or a low count of HDL, the good cholesterol. Tackling metabolic syndrome is vital not only for your heart health but also because it's linked with other serious conditions like sleep apnea. To trim your belly fat and ward off metabolic syndrome, a well-balanced diet and regular exercise are your best defense. Breathlessness and leg swelling are serious. Congestive heart failure doesn't just happen to men. Women are also vulnerable. There are over 2.4 million women out there living with a heart that's struggling to pump and circulate blood effectively. It's not a selective condition. Its risk factors are numerous, including coronary artery disease, high blood pressure, previous heart attacks, heart infections or inflammation, valve diseases, irregular heartbeats, congenital defects, obesity, diabetes, excessive alcohol consumption, and kidney disease. This is your wake-up call. Be conscious of the signs and symptoms of congestive heart failure. These symptoms can sneak up on you subtly as you age or suddenly appear out of the blue. Be aware of the warning bells: persistent coughing, unexplained fatigue, breathlessness, difficulty walking long distances, fluid buildup in your lungs, swelling of your feet, ankles, and legs, and an unusual heartbeat. Women must be vigilant about these symptoms and not turn a blind eye to them. Seek professional healthcare advice if you notice any of these signs. The intensity of heart failure symptoms can vary from person to person, from mild to severe. However, a heart failure specialist stands ready to help you manage these symptoms. Remember, knowledge is power, and understanding the signs of heart failure could make all the difference. Get moving for 30 minutes daily. For all the women out there, did you know that regular exercise is a lifesaver for your heart? Yes, it's undeniably true. Exercise is your best bet for safeguarding yourself from heart disease. This fundamental habit helps you dodge scary heart attacks or strokes, keeps your blood pressure in check, manages your cholesterol levels, and shields you from diabetes and obesity. Keeping your body mass index, BMI, in the sweet spot is super important. Maintaining your BMI in the range of 18.5 to 24.9 is the goal. Anything above 25 ticks the overweight box, while 30 or above falls into the obese category. With about 64% of women tipping the scale either as overweight or obese, it's high time to take action. So, what's the plan of action? It's simple. Just 30 minutes of brisk walking daily can do wonders for your heart's health. Alternatively, you could opt for 75 minutes of high-intensity workout twice a week and strength-building exercises. This combination is magic. It's perfect to keep the threat of heart diseases at arm's length. That's a wrap. We hope you liked the video. Do not forget to subscribe to our channel for more informative content on health and wellness. Remember, small lifestyle changes can make a big difference in reducing your risk of developing heart disease. Take care of yourself, and stay healthy.